Rainey. We are going to be demonstrating our fibromyalgia stretching program. I'll be walking you through. We're not going to do everything in the same duration, but we're going to do all the techniques, and I'll talk to you about the duration I do it for. First, what we want to do is work on the AA joint, very important joint for all people. So what we do is we bring all the way into a flex position here, and I rotate him. And then I say, Daniel, gently try to turn your head to the left and rest. Once again, and rest. All the way to the right now. Gently try to turn your head to the right and rest. Once again, and rest. I bring it back down. I like to get 10 contractions through there, so 5 rounds of that. Gently try to push your head to the left and rest. Gently push your head to the left and rest. I always say gently first, because if you say push, they start going full go before you even get to say gently. Gently push your head to the right and rest. Once again to the right and rest. That one, same thing. I like to go 5 rounds of those 2. Then I move down here, demonstrate it on this side. I do it both sides, I'll just demonstrate it on this side. Forearm stretching. So what I do, make sure I pronate, extend the elbow all the way. I like to bend the fingers with it as well. Can you see that on there? Get the fingers bent. So I'm stretching those wrist extensors. Then you'll gently push into my hand and rest. I do that 3 times there. So that one's just 3 for the peripheral muscles. Then I supinate him, keep the elbow extended. Use my leg right there, provide a stretch to the wrist flexors, gently push into my hand, and rest. I'll do that 3 times each side. And if I could have you sit up, face this wall now, please. And have your hands on your head, just on top like this. And have you turn all the way to the right. When I get here close, put my hand right here, just lateral to the spinous processes, the midline. Now gently turn to the left and rest. Once again, and rest. Now twist all the way to the left. Gently turn to the right and rest. Gently turn to the right and rest. Good. Again, 5 rounds of that, since that's a spine one as well. You can bring your hands down, lie on your right side now. This one I'll demonstrate both sides so we can see front and back. So this one, it's targeted at gapping, stretching that lumbar area. I like to get his waist about even with my waist. Scoot forward until your stomach touches my arm, please. Scoot towards me. Very good. And straighten out this bottom leg. Gonna bend this top leg. Keep that bottom leg straight. Bend this top leg. Very good. Until I start to feel a little movement in that lumbar spine. This one, I like to see how it moves, make sure he feels stable there. I want to raise up just a little bit. I'll sometimes spend a minute here. How's that feel there, Daniel?
It's alright.
A little bit of a stretch there at end range. Okay, so Daniel, when I ask you to, so right here you're straight, I stretch you out of straight. When I ask you to, I want you to straighten out to where we started, okay? When I ask you to. Okay, push back. Rest. Again. Rest. I do that just 10 times there. I'll be flip over to the other side. Same thing here. Straighten up. Bottom leg. And this one here. Let that arm rest. Make sure I get that leg right there. I want to make sure that he's stable and get a good stretch there. Make sure my arm all right there.
Yep.
Okay, and then again, so the cueing on this one is one of the more difficult ones to do sometimes. So see, you're straight there. I'm going to stretch you. When I ask you to, I want you to push back to that spot. So it's getting those words down, getting the cueing so they get it. Some people it takes a little bit more teaching than others. Okay, push back. 1. Again. 2. We go all the way to 10 there. All right, I'll have you on your back now, Daniel. Facing the ceiling, scoot towards the center. Lower this leg. We get piriformis stretching here. So here I have an angle, so the middle of his tibia, direct line to that opposite shoulder. I come right here. Feel a little bit of a stretch there?
Definitely.
Gently push your leg into my chest. Notice I always say gently first. Rest. Typically I have them hold it for 3 seconds on these. Again. And rest. I'll do that both sides. And then let this leg just lay flat there. Have his leg right here on that side of the knee. Just stretch. Feel a little bit of a stretch there. Or get those glutes just a little bit differently. Gently push into my hand there. And rest. Once again. And rest. Again, since these are not spine ones, they're periphery, I go 3 at a time on those. I'm just going to be showing the one side here. Next, we're going to go hamstrings. So this one, I have you bend your knee just a little bit. The reason I have it like this, you have the knee all the way straight, you can get into some of the sciatic nerve tension, which isn't the purpose of this. If the knee is all the way bent, get more hip flexion, sometimes it starts to impinge. I don't want to that's not the goal of dealing with that here. Feel a bit of a stretch there? So gently push into me. And rest. If they've been having trouble with gently earlier, you want to be careful with this one. It could really twist you here. Gently push again. And rest. Very good. I'm going to show the other side on this one, otherwise I would move the table because I'm going to do adductors. I bring that leg up. Raise the table a little bit. We're going to be stretching adductors here. And just keep that leg right there. I always put this hand just proximal to the knee joint. Otherwise, just a little bit higher. Otherwise, you just kind of torque that knee. If you let the leg roll out, you can get more, but that's not the purpose. So I like to keep it pretty perpendicular to the ground. It rolls out a little bit. Daniel, gently push into my hand right here. And rest. Once again. And rest. So do that 3 times there. All right. Can I slide off your shoes?
Sure.
So then, I want to get the plantar aspects here, so the plantar flexors and the plantar muscles of the feet. So notice I get right on the toes there. I push back there. I get a stretch all the way up there. Gently push into my hands, Daniel. Rest. Once again. Rest. Once again. Rest. Very good. All right, Daniel, I'm going to have you stand up. Walk around to that edge of the table. Bring this right about there. I'm going to have you sit right here on the edge. This is going to be the last one. I'm going to have you bring this knee up to your chest, and I'm going to lay you back onto the pillow. Very good. And see how this knee is barely over the edge? I let his leg rest right there, and I drag him down to here. You can ask him all you want to stay at the edge, but it's difficult. So I just find if I just put him where I want him, it works out better. Put my hand right here. Sometimes I have them hold it. I like to have as much control as possible. I put my hand right here about on the quad tendon, just superior to the patella. And I had a little bit of a stretch right there. Feel a stretch through here?
No, I do.
Okay. I might play with a little bit of adduction. I mean, what I feel gets in the best stretch and is comfortable. Gently push up into my hand right here. And rest. Once again. And rest. And then my leg right here is blocking that knee extension. Gently kick your leg up into my leg. And rest. I'll stretch it a little bit more. Let's get some more of those quads once again. And rest. Very good. And then I switch it. When I switch, I make sure I help control their legs while they switch. We won't show it on this side for the sake of the video, but I would do 3 times each side for both of those. I'm going to have you sit up, Daniel. And then I support that leg and I help him up. That's our fibromyalgia stretching program.